Let's talk about the EKG. So, your heart, the heart is a muscle which undergoes activity, in terms of passing electrons, electric activity to create muscle contraction. So when this happens, that kind of spreading of electricity across the heart can be detected at the surface of the skin, and that gives you a wave that we call the EKG wave. So your EKG is caused by your depot and repolarization of the heart muscle. And when it occurs, we can detect it with electrodes placed on the skin, which we do in the lab. Normally do it in the lab. But what you get are three waves. So the waves are this. Okay. You have what's called a P wave, the Q, R, S wave or segment, and the T wave. Okay, so these three waves that you see in EKG, which stands for electrocardiogram, occur when these events are occurring in the heart. So the P wave happens during atrial contraction, or atrial depolarization. So right before the atria contract, they must first depolarize. That's when the SA node is spreading across the atrial walls. You get the P wave deflection, okay, atrial depolarization, which precedes atrial contraction. Your QRS wave or segment happens during ventricular depolarization. So when the ventricles are being activated, so the ventricular depolarization will drive the QRS wave, and your T wave happens when the ventricles are being repolarized. So ventricular repolarization. So please note for me what causes the three waves, the P, QRS, and T waves of your EKG. Now sometimes from here as well, so let's say that you have another wave right behind over here. So here's another P wave, right? Q, R, T wave there, okay? So P, Q, R, S, and T again. The time from one R to another R, we call your R to R interval. That's usually the time required to go through one cardiac cycle. So the R to R interval is the duration of one cardiac cycle. Another thing here from the EKGs are easy and hard to interpret. The basics are good. Once things go abnormal, it requires a trained physician to know what these abnormalities are. But sometimes one of the more common ones that people see is when the ST segment from here to here, when it goes up. Sometimes it may do this. Get like this, elevate it this way. Okay, that's called an ST elevation, where the S part comes up and it's above the baseline. Usually this elevation of the ST normally indicates a heart attack as happened. Okay, but it's also normal in young people and athletes to have it there. So you can't jump right ahead to this conclusion. Normally you have to based on the history of that person to see if that means just normal deflection, or is it an abnormal elevation suggesting that the person suffered what's called an infarct. And sometimes as well, it may even get lower like this. That's called an ST depression. And normally when this happens, it means that there's probably bleeding, hemorrhaging in the heart. So it's called ischemia. Something's happening in the heart to prevent blood from flowing properly around the heart muscles. So ischemia means loss of blood flow. And it's ischemic situation there. Okay, so that's the EKG. Let's pause.